Okay, so we're back, and that means it's time for another deep dive
Always exciting to be back.
into the world of all things AI.
Yeah, absolutely. And, things move so fast in this space, so it can be hard to keep up.
Yeah, so that's kind of the mission for today, right? We're going to try to give everyone listening a really clear, like 10-minute snapshot of the current state of AI in healthcare, and maybe more importantly, like where things are headed, what trends to watch.
Yeah, sounds good. A 10-minute briefing on what's most important in AI and healthcare right now.
Exactly.
Yeah.
And, it's interesting because just a couple years ago, the conversation was really dominated by ChatGPT.
Right. I mean, ChatGPT really did kind of come out of nowhere and got everyone talking about generative AI and all its potential.
Yeah, and I think what's really interesting is to see how that conversation has evolved, specifically within healthcare. In 2024, we saw a lot of early adopters starting to really experiment with practical applications, but it feels like 2025 is going to be the year where things really start to accelerate.
Hmm.
There's definitely a greater risk tolerance emerging.
Yeah. And I think that comes from a better understanding of the value proposition. Healthcare leaders are no longer just chasing the buzzwords. They're demanding a return on investment.
Yeah, and that makes sense, right? Efficiency, cost savings, those are the key drivers.
Exactly.
Okay, so let's jump into some specifics. Where are we seeing the most traction with AI in healthcare right now?
Well, one area that's really gaining momentum is ambient listening for clinical documentation.
Ambient listening. So like AI is actually listening in on patient visits.
Yeah, exactly. It's using AI-powered audio solutions to basically analyze the conversation between a patient and their provider in real time.
Wow. So it's not just recording, it's like understanding what's being said.
Yeah, and it can then extract like the key information that needs to go into the clinical notes and even for billing purposes.
Okay, so it's like freeing up the clinician to actually focus on the patient.
Exactly, and that's a huge benefit. It improves efficiency, reduces burnout for the clinicians. It's a win-win.
Yeah, that makes a lot of sense. So would you say ambient listening is like a good entry point for healthcare organizations looking to adopt AI?
Yeah, it's definitely considered to be like low-hanging fruit along with things like automated chart summarization.
Okay, so we have AI listening in on conversations, but how do we know it's actually getting things right? Accuracy is obviously critical in healthcare.
Yeah, absolutely. And that's where this concept of retrieval-augmented generation, or RAG, is really interesting.
ROG, I'm not familiar with that.
So basically, it's a way of making generative AI more accurate and transparent by combining it with something called a vector database.
A vector database. Okay, now you're losing me.
So imagine like a chatbot, but instead of just searching the whole internet for information, it has access to this internal library of knowledge that's specific to the healthcare organization.
Hmm.
Like clinical guidelines, best practices, all that kind of stuff.
Ah, so it's drawing from a more reliable and curated source.
Exactly, and that helps ensure the accuracy of the output. Healthcare professionals need to be able to trust the information that these AI systems are providing.
Yeah, for sure. And are there any like organizations that are specifically focused on evaluating these AI models to make sure they're up to snuff?
Yeah, there are groups like the Coalition for Health AI who are creating these really rigorous evaluation frameworks to assess these models and make sure they meet the standards required for healthcare.
Okay, that makes sense. Now, what about this idea of machine vision?
Yeah.
Using cameras and sensors in patient rooms. Is that actually happening?
It is, and it's pretty amazing to see in action. So you've got these cameras and sensors in the rooms collecting all this data, and then AI is used to analyze it.
So like what kind of data are we talking about?
Well, for example, it can detect subtle movements of a patient in bed, which can then inform the care team. Maybe they don't need to be turned as often, or it can detect if a patient is trying to get out of bed unassisted, which could prevent a fall.
Wow, so it's really about improving patient safety and freeing up staff time.
Exactly. And, in the future, we're going to see this kind of machine vision combined with ambient listening for even more proactive care.
So AI is really impacting both the patient experience and the workflow of the healthcare providers. Now, what about all the administrative stuff, all the paperwork and processes behind the scenes?
Yeah, that's another area where AI is making huge inroads, automating tasks like data entry claims, processing appointment scheduling.
So it's like taking over the stuff that nobody wants to do.
Exactly. And that frees up healthcare professionals to focus on what they do best, which is taking care of patients. Plus, it can reduce human error, faster review of records, imaging claims, test results.
Yeah, accuracy and speed are always a good thing. Now, I've also heard this term agentic medical assistance. What exactly does that mean?
So this is where things get really futuristic. It's basically the idea of AI agents that can act autonomously to improve efficiency and patient care.
Autonomous AI in healthcare. That sounds both exciting and maybe a little scary.
Yeah, it's definitely cutting edge, but the potential is huge.
Okay.
Imagine AI that can analyze patient data images, lab results, and help speed up diagnoses, maybe even catch things that a human might miss.
So it's like having a really smart assistant working alongside the doctors and nurses 24/7.
Yeah, and these agents are constantly learning and adapting, so they're only going to get better over time.
Now, what about medical coding?
Mm.
That's a really specialized area that can be incredibly complex.
Yeah, and that's where generative AI is proving to be really valuable. It can automate the process of assigning medical codes by analyzing clinical notes, summaries, and other documentation.
So it's like taking the human element out of coding.
Well, it's more about augmenting the human element. It can understand medical abbreviations, complex language, and then suggest the most appropriate codes.
Okay, so it's streamlining the whole process and reducing errors.
Exactly. And we're even seeing the emergence of real-time conversational AI assistants that can help clinicians with coding as they're documenting patient encounters.
Now, with all this talk about advanced AI, it seems like healthcare organizations would need to have a pretty robust IT infrastructure in place.
Yeah, absolutely. Scalability is key, and that's why we're seeing a lot of organizations moving towards cloud-based solutions.
And are there any concerns about data security with cloud computing?
Yeah, that's a valid concern, and many organizations are opting for a hybrid approach, leveraging the cloud for certain applications while keeping sensitive data on-premise. But the cloud definitely offers advantages in terms of scalability and accessibility.
What about this concept of edge computing? How does that fit in?
So edge computing is all about processing data locally, closer to where it's generated. And that can be really beneficial in healthcare because it reduces the strain on centralized systems and allows for faster analysis of data.
Okay, that makes sense.
Mm.
Now, one of the biggest challenges facing healthcare right now is the shortage of skilled professionals. Can AI help with that?
It can actually, AI-powered HR tools can help streamline the hiring process,
Hmm.
screening candidates more efficiently and even matching them with the right positions. And then on the patient care side, AI can automate tasks and free up existing staff to focus on direct patient care.
Yeah, and we're also seeing a lot of innovation in telemedicine and remote patient monitoring.
Absolutely. And that's a game changer. It allows healthcare providers to reach more patients, even those in remote areas, and it can help reduce wait times and improve access to care.
Seems like all these trends are pointing towards a more personalized approach to healthcare.
Yeah, that's definitely the direction things are moving. The goal is to tailor healthcare experiences to the individual patient's needs.
So how is AI enabling that?
Well, for starters, it can help healthcare providers access and analyze patient data more quickly and efficiently so they can make more informed decisions. We're also seeing the development of AI-powered dashboards that give clinicians a complete picture of the patient's health history, medications, allergies, all in one place.
Okay, so it's like having a personalized health record at your fingertips.
Exactly. And then there's this whole concept of personalized medicine 2.0, which goes beyond just genomics. It's about incorporating real-time biometric data to create truly customized treatment plans.
That's incredible. Now, with all this advancement in AI, are we likely to see more regulation in this space?
Yeah, I think that's inevitable, and it's important. We need to make sure that AI is being used safely and ethically in healthcare.
So it's about finding that balance between innovation and patient safety.
Exactly. And a lot of healthcare organizations are already proactively looking at how to comply with existing regulations, like the ONC's HTI-1 final rule, which focuses on data interoperability.
Okay, now, for healthcare organizations that are thinking about implementing AI, what are some of the key things they need to consider?
Well, first and foremost, they need to have a solid IT infrastructure in place. The speeds and feeds need to be there to support these advanced AI applications.
So it's not just about buying the software, it's about having the foundation to support it.
Exactly. And then it's really important to think about how these AI tools are going to be integrated into existing workflows. You need buy-in from the clinicians and staff who are going to be using them.
Yeah, user adoption is crucial.
Hmm.
And I imagine budget is also a big consideration.
Oh, absolutely. Healthcare organizations have to be really strategic about where they invest their resources. They're going to prioritize AI solutions that have a clear return on investment,
Hmm.
that can demonstrably solve a problem or improve efficiency.
So what role do technology partners play in all of this?
Well, they can be really valuable partners. They can help healthcare organizations develop a data strategy, implement modern data platforms, and deploy generative AI solutions effectively. They can also provide training and support to ensure that the technology is being used to its full potential.
Okay, so it's about finding the right partner who can guide you through the process.
Exactly.
This has been a really fascinating overview of the current state of AI in healthcare. But what about the bigger picture? Where do you see all of this headed in the long term?
Well, I think we're just scratching the surface of what's possible with AI in healthcare. We're going to see the development of even more powerful algorithms, and healthcare organizations are going to become true co-innovators in this space.
So it's about moving beyond just using AI to actually shaping the future of AI in healthcare.
Exactly. And the ultimate goal is to create a healthcare system that's more preventative, personalized, and data-driven,
Yeah.
where disease management is proactive and tailored to the individual.
And we're seeing a lot of excitement around this from industry leaders.
Yeah, absolutely. People like Kimberly Powell at NVIDIA have been really vocal about the transformative potential of AI in healthcare. They're talking about accelerated computing, domain-specific AI. It's all about pushing the boundaries of what's possible.
It seems like there's real focus on leveraging AI to deepen our understanding of biology.
Yeah, there's this huge push towards using generative AI and foundation models to understand the complexities of the human body.
Oh.
Examples like the EVO2 genomic foundation model are really groundbreaking.
And that's leading to some really exciting advancements in drug discovery.
Yeah, we're seeing AI agents that can work alongside scientists to automate research and accelerate the process of developing new drugs. And these tools are becoming more accessible so more researchers can benefit from them.
What about this concept of physical AI? I've heard that mentioned.
So physical AI is basically combining AI with robotics and real-time sensing platforms like NVIDIA Holoscan. And this has incredible potential in areas like surgical robotics and medical devices. Imagine AI-powered robots that can assist surgeons with complex procedures or smart devices that can monitor patients in real time.
That's pretty mind-blowing. And then there's the collaboration between NVIDIA and Epic to integrate AI into their EHR system.
Yeah, that's a massive undertaking that could potentially impact hundreds of millions of patients. It's a sign of how seriously the industry is taking AI and how quickly it's being integrated into mainstream healthcare.
So in just 10 minutes, we've gone from ambient listening to AI agents to physical AI. It's clear that the world of healthcare is undergoing a massive transformation thanks to AI.
It is, and I think the key takeaway here is that this is just the beginning. The trends we've talked about today are really just a glimpse of what's to come.
Yeah.
The future of healthcare is going to be shaped by AI, and it's going to be incredibly exciting to see how it all unfolds.
Well said. So for everyone listening, I'd encourage you to think about which of these AI-driven trends you find most intriguing or maybe even a little unsettling, and consider the ethical implications as this technology continues to evolve. Because one thing's for sure, the conversation around AI in healthcare is only going to get more complex and more important in the years to come.
Absolutely. It's a conversation we all need to be a part of.
Thanks for joining us for another deep dive. We'll be back soon with more explorations into the ever-evolving world of AI.
Until next time.
Take care.
Bye.